Hello. Today I'd like to talk about ultrasound certifications, more specifically musculoskeletal ultrasound certifications, and even more specifically I'm going to talk mostly about the US. Now, if you don't already use ultrasound, then you might not be aware that there is no licensure, like state licensure for ultrasound for the most part. Again, I don't necessarily know what's going to change, and every state could have something different, but as far as I'm aware, there's no licensure even for sonographers. And even the standard certification for sonographers, which is by the ARDMS, that is a voluntary certification and it isn't a requirement to work as a sonographer. Typically, if you look for sonographer jobs, they'll say, "Oh yeah, we require you be licensed or not licensed, but certified by the ARDMS, by the end of your first year working for us." Right? Which means they've been working as a sonographer for a year before they get that certification. So these certifications aren't mandated by a law. So what's to say what education you have? Whether you're trained in it or not. Well, right now it's a little bit the Wild West. Now, in Europe, they have this sort of figured out. In the UK system, you can get a PG cert, postgraduate certificate, a PG DIP, a postgraduate diploma, or a Master's of Science in musculoskeletal ultrasound. And of course, those different levels indicate how much training you've had in that discipline, in this case it's musculoskeletal ultrasound. But Singapore is talking to a someone working in an imaging center, and they only had a weekend seminar. In Indonesia, it's 3 weekends. And that's a certification for, again, radiologist level certification. But of course, it's opened up to point of care practitioners as well if they want to learn to add it to their practice. So what's it like in the States right now? There are actually some certifications. About a little over 10 years ago, the same organization that creates the certifications for sonographers created some certifications for physicians. And they created the first musculoskeletal certification, the RMSK certification. And that's, maybe it's 12, 13 years old now. So it hasn't been a long time since it's been around. But you don't need that certification to use it. You just have to get some training. But, and I'll even speak from my own experience, don't try to bill for imaging without having something to show the insurance company, because they will ask. Maybe if you're a radiologist, they won't ask. But if in my case, I'm a chiropractor, the insurance company, every time I build a different insurance company, they're like, whoa, 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 whoa. How do I know you're trained in that? Well, then I would send them my RMSK certificate, and I'm like, oh, okay. So having a certification makes it easier to prove to insurance companies that you have the training, or else you'd have to say, oh, well, I did my training here. It was this weekend seminar or this weekend seminar, or like, and they might not buy it, right? So certifications can help with reimbursement. Now I'm going to talk about 3 different certifications today and 1 pseudo certification. The first certification I'm going to talk about today is by the Point of Care Ultrasound Certification Academy. This is a sister organization to the ARDMS, which certifies sonographers, and to the APCA, which certifies physicians. And they're the ones that do the RMSK certification. So this is an organization that's at that level, but their focus, one of the organizations focuses on sonographers. APCA focuses on physicians who are specializing in imaging. Like, that signifies that you're an expert in that field of imaging. Now, what about point of care? And this is a point I've tried to make in my own ultrasound education when I teach it, is that you don't need to master every single scan to start using ultrasound. It has been shown time and time again, if you train a doctor with an hour or 2 of training on one skill, that they can be, basically as good as a specialist. Some of these imaging findings are pretty easy to identify, and so with just a little bit of practice, you can find that one finding. Again, you're not an expert in everything with ultrasound, but you're an expert in that one finding, so you can start using it in practice right away. And so the POCUS Certification Academy is focused on those doctors learning one skill at a time. Right. And so they have a couple certifications and certification exams. They have a POCUS fundamentals exam. And I did this myself because I was like, well, if I'm going to start learning this, I want to at least have something on my wall that says, hey, I at least know the absolute basics. And that's sort of their idea here. Before you start using ultrasound, learning ultrasound, you should do the POCUS fundamentals. This is the fundamentals of how does ultrasound work. So they have like a 1 hour, maybe it's a 2 hour educational module, and then you write the exam. Now then you're supposed to practice, and ideally you have a mentor teaching you, or you take a course, or you take one of those weekend seminars, and you start to learn, and you start to use it on patients. And then once you've used it on 20 patients, then you can validate your proficiency with certification. Look at all the different certifications they offer. Right. Again, obstetrics, maybe you just learned the first trimester. Maybe you just learned the second or third trimester. Right. Maybe you only learned a little bit of musculoskeletal soft tissue. Maybe you learned some of the lower extremity scans. So you can add on certifications as you gain proficiency. They actually also have packages, these specialty certifications, where it's a package. So maternal fetal health certification is first, second, and third trimester together. Musculoskeletal certification is all the musculoskeletal certifications all together, and you save a little bit of money. Now, in terms of the requirements, I mentioned you have to scan at least 20 patients. You have to have some of your peers review you, and you have to write an exam. You also have to submit a video of one of your scans. Now, the POCUS Certification Academy is not an educational provider. They do partner with educational providers that they approve, but they don't call themselves an education provider. They do certifications. That being said, they do have educational content on their site, such as quick reviews, quick webinars, blog posts. Sometimes they're just one-page PDFs, which are awesome to print out if you want a quick refresher on how to do a scan. Okay, what are all the items I need to scan to complete this protocol? So they're an excellent resource. And if you take a course at one of their education providers, then you will get a 40% off their fundamentals exam, and you'll get 20% off the clinical certifications. So there's a financial incentive to learning with one of their approved education providers, and I happen to be one of the approved providers. The next certification I'm talking about is the RMSK certification with the APCA. This is the certification I have, so I did this exam and I went through this process. So for this process, you have to be a physician level doctor. This is actually also going to be true for the next certification we're covering as well. You have to have completed 150 scans on patients within the past 36 months. And someone has to attest for this. So you have to have a supervisor or a colleague attest that you have completed these scans, which I offer that service, by the way, wink, wink. Make sure that no more than 5% of these cases are therapeutic, giving an injection or doing an aspiration. The vast, vast majority of these should be diagnostic. There are no education requirements, but they recommend you getting 30 hours of training. My education course covers, 80 hours of training, for example. I actually have a smaller package of just the required information necessary to prepare for the RMSK exam, because the RMSK really is designed for physician level practitioners, particularly radiologists. And so I can't do interventional procedures. So even though the exam was on interventional procedures, that wasn't relevant to me. And that being said, ultrasound, the scope of what it's useful for continues to change. So there's a lot of what I cover in my entire program that isn't going to be covered on the RMSK exam. For example, I cover useful other exams. For example, back pain, a useful exam, sometimes for differential diagnosis, is checking for AAA, abdominal aortic aneurysm. Leg pain, sometimes useful to check for DVT. That isn't going to be on the RMSK exam. So in my own educational offerings, I remove that from my smaller package for people just interested on the RMSK. My complete bundle would satisfy or would well prepare you for the RMSK exam, also the POCUS Certification Academy exams, and for our next exam. Our last exam is by the International Academy of Neuromusculoskeletal Medicine, and they consider diagnostic ultrasound to be a subspecialty. And I'm actually the official educational program for this subspecialty, although they do accept other educational credits. Now, if you're a diplomate of the IANM, they also offer an official fellowship for diagnostic ultrasound, which again, I participate in, or it can be done through me or through another approved mentor. And so if you're a diplomate and you go through the program and the fellowship, you could call yourself a fellow in diagnostic ultrasound with the International Academy of Neuromusculoskeletal Medicine. So if you're interested in that, well, that's one path you can follow. Actually, I recommend becoming a diplomate of the IANM if you're interested in becoming an expert in diagnosis and management of neuromusculoskeletal disorders. This differs a bit from the other ones in that there is a pretty strict education requirement. And this education requirement requires you to go through and analyze 150 cases, but not perform 150 cases. So if you just go through the 8-hour program, which includes 150 cases, then you can then write the exam, and that will give you a credential of CNMS credential. So in my mind, well, you could get both. You could get the RMSK credential and you could get the CNMS credential. Why not get both? Put a whole alphabet after your name like I have, right? This is new. In fact, no one has finished the program yet to write the exam yet. But the IANM and the other organizations I've talked about so far, these are credentialing organizations. They have to maintain these credentials to a certain level. Like they're expected to hold themselves to a certain level because they're also credentialed by credentialing organizations, right? They have to meet requirements by the AMA or the ACA for the American Chiropractic Association, and like they have requirements to keep for their certifications. You have to pay yearly fees and you have to have continuing education requirements. So these organizations, it's not just a money gram. Oh, if you want to keep on using your credential, you have to keep on paying us. It's you're paying because they have to check and do audits and make sure that you're taking continuing education. And that's a requirement for their certifications because these organizations need to maintain that level of quality for their certifications. Now, that's in contrast to our next pseudo certification. Even before I go there, maybe I'll talk about my CFMP certification. So I am a certified functional medicine practitioner. So I can use this credential after my name. But this organization, Functional Medicine University, this isn't a credentialing organization. I don't have to pay, maintenance of credential fees. I don't have to do continuing education requirements to maintain this. This is just a company. And it's a company ran by like one guy. Now, not to discount the education. The education was great. I'm still proud of this, but this is my weakest certification by far because it's just certified by a guy. It sounds impressive. I'm CFMP by FMU. Sounds impressive, but this is not a credentialing organization. This credential, this certified, I'm not certified by one of these high-level credentialing organizations. I'm certified by one guy's company. Now the next pseudo certification is one of these certifications where you're certified by just some guy's company, and it's not a credentialing organization. It's not a certifying specialist organization. It's just some guy's company. So here we are. At the American Academy of MSK Ultrasound. Ooh, that sounds so fancy. Wouldn't it be great to get a certification from the American Academy of Musculoskeletal Ultrasound? That sounds just as fancy as the International Academy of Neuromusculoskeletal Medicine, right? But again, this is not a credential organization. This is just an educational company, just ran by a couple people. And let's look at their options here. They have a certificate program, and that's that price. They have a diplomate program. Ooh, I'm a diplomate of the American Academy of Musculoskeletal Ultrasound. Ooh, that sounds so fancy. Oh, a fellowship. Now, they removed the price on this. It used to be $28,000. But this was used to be like $9,000 or $8,000 or $9,000. So they have dropped prices. So I don't know how much they're charging now. My training program, I think, is quite similar to this, particularly if you do the fellowship. And again, my fellowship is an official fellowship by a credentialing organization. Again, it's a mentorship for anybody, but it's only a official fellowship if you're a diplomate. But still, this is just a fellowship with some education company. So they've trademarked FMSK, the credential. And of course, they're the exclusive provider because it's just from them. In fact, for my own educational program, I debated doing exactly what they did, just register a trademark. But and that would have been a lot easier for me. But in the end, I went with working with a credentialing organization, and they trademarked the CNMS credential, and they administer the exam, and they maintain the credential. I just do the education part, right? So obviously, if you want to do this, I mentioned you don't need any certification, so this sounds fancy. But for myself, I went with the RMSK, and now there's more options. You have that POCUS Certification Academy, you have the RMSK, and you have the CNMS, and you could do them all if you want. Anyways, cheers.